Hi, I'm Chelsea. I am co-president of Nutrition Without Borders at NYU, and I'm here today with Saad Hasan, or Dr. Hasan. We are partnering with the NYU School of Dentistry to talk a little bit more about what oral public health is and how it is associated with nutrition. So thank you so much for joining us today,
Thank you so much for having me.
Yes. We know that you're a student doctor at NYU's School of Dentistry and that you previously studied neuroscience and molecular biology at UT Dallas. Can you tell us a bit more about what drew you to the field of dentistry?
Thank you so much for having me today. I'm really blessed to be here with y'all and talking about dentistry and just kind of like public health in general. It's actually something that's a big passion of mine. And actually, when I tell the story of why I actually chose dentistry, it's interesting. People kind of find it to be a little unique because I actually really like dentistry because I like spit. And people think that's kind of weird because spit's like a kind of gross thing, kind of thing you don't like when you go to the dentist. But the thing about spit that's interesting is that it has this ability to buffer acid in your mouth. And it has this ability to kind of coat your teeth in a way that it takes away sugar and cavities. And what's beautiful about spit, as gross as it is that it actually works really hard to keep your teeth clean. And for me, I'm very motivated by that because I want to work as hard as spit to keep people's teeth clean. And I think that's my motivation towards public health because I feel like it's a great responsibility on my shoulders to find a way that I can serve people to keep them clean.
Wow, that's a really interesting take. I don't think I've ever heard anyone say that spit is a motivator, but it's great how you've linked that into your interest in public health. So yeah, although many of us here are involved in the public health track, many if not all of us, oral public health is not a term that we usually discuss in these spaces, and so it's maybe a new term for me and maybe for others. So could you talk more about what oral public health means to you?
Sure. So oral public health has an interesting concept, and I think when we look at the field of public health in general, it has a different meaning to every individual, but at the same time at a global level, I think every country has a different priority when it comes to healthcare. When it comes to oral public health, right, when we deal with the health of somebody's mouth, I think the priority here in America, unfortunately, isn't that high. And the reason why I say that is because there's a fantastic book by Mary Otto, who writes a book called Teeth, and the public health crisis, oral public health crisis in America, because there's no preference for insurance or ways that people who are going through severe amounts of pain without an ability to afford insurance to go and take care of their own health care. And I guess when we look at things we define health in general, you would say an absence of pain or an absence of sickness. And I think when we look at our American system for oral public health, are we taking initiatives to remove infection and lack of health to people's oral cavity all across the nation? I think that we have quite a bit of work to do here in America.
So you would agree then that maybe it's challenging to shift public opinion that oral public health is something that needs to be addressed severely then?
Right, of course. I think a lot of people, I think it has a lot to do when you look at a public health standpoint with things like social determinants of health, when you look at things like education in general. When I've had the privilege and been very blessed to be on several outreaches domestically across the nation and abroad, Dominican Republic and Peru and Morocco. And one thing I see a lot is education linked to the idea of public health? And I think it very much is. Having the ability of just having a toothbrush isn't as common as you thought. I think a lot of times if I ask you, I was like, oh, do you have a toothbrush? You'd probably laugh and be like, is that even a question, right? But I think a lot of places that you visit, it isn't a financial priority, right? If you can't afford to put food into your own stomach, is brushing your teeth the same value? And I think a lot of times we kind of separate our mouth from the rest of our body, right? Where we say, oh, I don't have pneumonia, or I don't have this disease, but in my mouth I think it's fine, I'm not in pain, right? So I think a lot of times we link health with pain, and I think a lot of times when I see patients, the thing that they say is that, oh, I didn't know I had all these cavities, I wasn't in pain. But once it becomes painful, then it becomes irreversible. And I think we need to put the priority of health, not just the idea with a lack of pain, but with the idea of there's a better life for you.
Definitely. That's a great take. So what are some examples, because we are Nutrition Without Borders, but what are some examples of how you see nutrition linking with oral public health?
Right.
I mean, they might be some of them might be more obvious. I know we're all familiar with the fact that scurvy is implicated or vitamin C is implicated in the reduction of scurvy back in the old days. And what are some other examples of nutrients or ways that nutrition and oral health are linked?
Right, thank you for asking that. I think what's interesting about nutrition, and actually we take several courses at the College of Dentistry that links nutrition to oral health. And I think when it comes down to the idea of what do we put in our bodies and how does it affect our oral health, the obvious kind of path is the idea of like, is something too sugary? Does it have refined sugar in a way that it's hurting our teeth? And I think when you look back in the past to our ancestors, they didn't have as many cavities, right? Or we refer to in the dental field as like caries infections on their teeth, but they had bone disease that held their teeth together. So at certain points in their life, their bone that held their teeth together started to erode away. But that's because they used to have grainy foods and they had less refined and less processed foods, and that was the main problem. But now that we're moving towards a system that has more refined or processed sugars, we're getting to a point where things can erode the top surfaces of your teeth and the way that you're biting as well, and cause cavities. So I think one thing we do with patients is we do a 24-hour dietary recall for patients that are higher risk for cavities or higher risk for what we refer to as periodontal disease, or the gum and bone health that surround their teeth. And what we do is we sit down and we track their dietary intake for the past 24 hours. And we can actually do this for several patients at a time. We actually have a nutritionist on campus. So I think that's fantastic. And I think the way that we're trying to approach this is not to make foods that induce cavities as negative things, but how can we work hand in hand with improving somebody's nutrition and health? With, say that you are you're a fan of sugar, right? Can we move towards a process of eating sugar more and better times of the day in which you can brush your teeth, right? If you have 2 sugars with your coffee, maybe you can limit to 1 sugar. If you do find ways of liking certain things, can we maybe find ways to chew gum after you have a certain meal if you can't brush your teeth, so that you can have some form of mechanical debridement, so that your mouth can digest these sugars faster.
Okay, so making reasonable changes in your dietary behaviors that will eventually affect or positively affect your dental health.
Correct, and I think it's the gateway to your body, your mouth, right? So I think what you're putting inside of your mouth definitely has a good effect on the way that your health is.
Well, I want to hear a little bit more. You've led some incredible missions, like you said, both domestically and abroad. So I wanted to see if you could give us an example of one or a couple of those missions and some cultural differences that you found in oral health routines or practices as they relate to nutrition as well, if possible, on some of your missions, if you could talk more about that.
So I am very blessed to be on some of those mission trips. In fact, in my undergrad at UT Dallas, I was a part of an organization called Volunteers Around the World, and our motto was volunteer time, donate your energy. And I love that, because us as college students are not the wealthiest people. So I think what a lot of times is that what we lack in our wallets, we are rich in energy. And I think the ability to donate our energy is so powerful. And I think the way that we should approach that process is what talents and skills are available to you that are things that you can perform in a way that you can serve other people. And I think we sometimes underestimate our ability to help others. And so on these trips that we were abroad, we actually assisted the local dentists that were there in providing free dental care to the underserved people of that area. And it's very interesting, like I said, right? In a way that when we see people who are underserved, I don't want to use the word poor or low socioeconomic status, but rather these people just have not been able to find a priority for their oral health. And I think our goal in treating them is also a way increasing their need to find a priority of oral health. So when we treat people, I think the idea of dignity is very important. I think when we focus on treating them as a whole rather than just their mouth, I think what you're doing is you're inducing this idea of oral public health, right? And then they will leave knowing that, hey, this part of my body is actually very important, you know? And I think sometimes when we find mothers that have children that are crying, their go-to option in certain Caribbean areas or even some Latin American areas is to take sugar cane and have them chew on it. So obviously they're building so many cavities before they even have a lot of teeth. So they're building this habit of, I don't know how to deal with this, so I thought this was the best way. So if we can find ways and give them dignity to their oral health, what we're doing is we're building their own knowledge and their own priority in their life of healthcare.
That's great. So you would say education is definitely a big component of these missions. And do you guys incorporate nutrition education as part of the overall programs?
For sure. Yes, I think nutrition, what we at times don't realize is that biologically we have a word we refer to more as health, which we call homeostasis. And that's when your whole body is going according to plan. And I think what we fail to realize, right, is that a lot of your holistic health has everything to do with your oral health. And I have a lot of patients that have come in with sores in their mouth, or they have not real any like tooth pain, but they have places in their mouth that are causing them pain, or you can tell that there's a lack of nutrition happening because of what you can find in their mouths. So we can tell patients that if they're severely dehydrated, or they're going through high amounts of stress, or they're lacking vitamin C in their diet, as you mentioned with things like scurvy. And the reason why this is really important is because we have to understand that food deserts exist and social determinants of health exist. So we need to move towards methods of how can we treat people in a way that's greater than just their oral health, but their whole body. And actually what's interesting is that we had a day off when we were in the Dominican Republic, and us as students chose to go out to a grocery store and buy packs of groceries for people in that neighboring area that actually had no access to groceries because either it was too far, they didn't have a mode of transportation, or they just didn't have the financial resources at that time to provide that. So we went and we personally hand-delivered a set of groceries to them, because we know that treating people and their oral health is also treating their bodies as well.
That's wonderful to incorporate that type of service into the mission that was already part of the program. So the CDC talks about the fact that domestically, oral health has improved overall in the U.S., but they do indicate that certain underserved populations, primarily Black, Latino, Hispanic, and especially American Indian populations, still have major gaps in their dental health in terms of the poor outcomes or higher risk for dental disease. So especially with Black and Mexican American children, they have the highest rates of tooth decay. And I want to just know about domestic programs or outreach opportunities that are intended to bridge these gaps, and whether you're aware of some of these.
So through the school at NYU College of Dentistry, in October, with a program we call the Henry Schein Care Program, we went to Plattsburgh, New York, which is an hour away from Montreal, to an area where we found people who didn't have much need didn't have much access, to oral public health, or just oral health care in general. So we actually have a public health program at the College of Dentistry that goes out and scouts these locations to see if healthcare and dentistry actually is needed in those areas. And what they were told is that you're not going to find patients because people are well taken care of. But we still went, and we had served over 400 patients in 1 week, and a variety of procedures. We did extractions, we did root canals, we did fillings, we did cleanings, the whole shebang. And the thing about us is that what I realized is that it's not that people are poor or they have or they just don't care about their health. I had a patient who, bless her heart, was amazing, and she said that I work 2 jobs and my daughter works 2 jobs and she's in college. It's just that I'm here because I can't afford to go to the dentist, right? Another problem that we really found in Plattsburgh, which again is in our own backyard, this is our own country, is that there is a limit to access to transportation. So you could live blocks away from the dentist, but still not be able to get there because you work 2 jobs and the dentist is only open from 10 a.m. to 6 p.m. So transportation is a very big problem. Access is a very big problem. So providing people an opportunity for a one-stop shop, you can come in and see our makeshift clinic in this ballroom that we set up in the community center, is a way that you can come see us for your root canals, your extractions, and your restorative treatment. We can take care for you in a day. And people were more than willing to do that because they've never had the opportunity to spend 1 whole day going to the dentist, because they will get quotes from Aspen Dental or another dental office and say that, I actually just can't afford this. I will make this a priority when it becomes financially a priority, and that just never happens. So I think what we need to figure out as a society is that where do we place our need for oral health care in terms of insurance or in terms of access. And I think that's just going to be something we're going to be working on for the next 20 or 30 years, and us as dentists need to take more of a role on.
And a collaborative approach among, as we're doing today here, spreading the word among other disciplines as well, I think is very important. So the CDC and the Bureau of Disease Prevention and Health Promotion Program, with the initiative of Healthy People 2020, cites things such as water fluoridation in different communities as a way to prevent these oral health issues in areas of underprivileged populations and lower socioeconomic status. And so what are your opinion on these types of initiatives and the efficacy of these programs?
I think they're truly fantastic. When I was back in Dallas, I was a part of the Dallas County Dental Society, and one of our board members actually had this statement where he said that we need to fight people that are fighting on the idea of that are against fluoridation in water. And he said that dentists are one of the few professions that are okay with hurting our own profession in order to better the health of others. And I think there is a lot of backlash to fluoride because there isn't an education that's available to saying, is this helpful or is this not helpful? So when we look at fluoride in its addition to water, right, we look at certain communities that may not have as much access to fluoride, right? Say local socioeconomic areas that are not buying as much fluoridated toothpaste. Having a healthy but higher sense of fluoride, which we actually measure out to be 1.2 parts per million of fluoride in water, is healthy because you're getting an additional supplement of fluoride in your water source. And just to kind of like break it down a little bit more, fluoride is very important because it allows for remineralization of teeth. So say that you have been just snacking out, it's Halloween, and you just love like candy, and you've just been get in those Snickers bars. And yes, you've been brushing and flossing. You just haven't been as consistent because you've been snacking so much. You kind of have accumulated this plaque in your mouth. Fluoride does this thing where it covers your teeth in a way that it takes more of an effort for that acid to degrade your teeth, and that's why we, as dentists, recommend fluoride. And we, and in our own offices, have very high concentrations of fluoride that we can use in a controlled amount. And I think it's a very healthy way of us passively attacking like cavities in the mouth and caries infections.
That's great. And so have you you in your program, or have you heard about different initiatives such as the school sealant programs, where student dentists go into different school districts and provide sealant for underprivileged communities at the site of the schools for children?
Right, and actually this is a really hot topic in dentistry, and I will provide both sides because I want to be very objective and I want the audience to kind of have their own views and their own understandings. I think public policy plays a big role in this, and the reason why I find this to be very interesting is that yes, we're as student dentists are very lucky to be able to go to schools and provide sealants or cleanings or even fluoride varnish, which is a high concentration of fluoride in a controlled setting to these kids. Is that at a legal level, most states only allow dental professionals to place these very helpful items on patients and kids. Now, that is contingent upon how much time each person is afforded, each dental student or each dental professional or hygienist is afforded in their opportunity to serve. So now we have to ask the legitimate question, is the ratio of those that are providing care also consistent with people that need care? And is that time being afforded to them? So if that is highly disproportionate, are we allowing these methods of transmission of fluoride to be given by school nurses, or what we can find to be dental therapists, right? Training people to be there to just simply place fluoride or simply do these really simple treatments that maybe dentists or dental students or hygienists don't have the time to do because they're out doing other things. So I think as a community, right, we need to be moving in towards a direction that we are expanding our care. And I think that's going to be a very hot topic of discussion among dentists, because I'll be honest, some dentists feel threatened by the idea that a local nurse can place fluoride. In my own personal humble opinion, I don't think so, because if you're threatened by the idea that some child in some school who needs fluoride treatment is threatening your ability to provide business, then I think we need to reframe our mindset of our priority of oral public health, and how do we are bettering the public health of our community by providing this fluoride treatment that they so desperately need.
Well, we'll stay tuned for more information as that topic continues to grow. We just talked briefly before we got started about how you had a patient come in, and I wanted to ask, what does that look like when someone comes in and it's an emergency oral situation? What does that look like in terms of funding? Because a lot of people are coming in, they're uninsured, they don't have the capacity for dental insurance. And so how does that work?
So it is very unfortunate, and at times we do have to turn patients away who are in pain because they don't have insurance or they're not able to pay the necessary amount. And I know dentists that actually will go around to nursing homes in certain areas that will actually provide free dental care. They'll literally walk in with their supplies. They'll schedule a time with the community center or the nursing home or a certain area, and they'll just come and bring their supplies, and then they'll just say whoever wants dental care can come in, and I'll do it for you for free. But in institutions like dental offices or colleges of dentistry across the nation, there is a formality of insurance that has to be involved. So do patients get turned away that need treatment? Yes. Is it something we feel bad about? Definitely. But the idea of bridging this gap has to come at a policy level. Are we insuring patients that need it? what's interesting about the book Teeth by Mary Otto is that she also talks about how patients who have never been able to afford dental care are going to emergency rooms to take care of some of their dental pain and abscesses because they've just never been able to afford a dentist. So now they're going to medical professionals to try to take care of their tooth pain because emergency rooms cannot turn them away. So are we providing them, those patients that are in severe amounts of pain, an ability to treat that pain? And I just think that we're unfortunately not doing that job yet. And I think over time, through dentists in the future that have a more public health, public policy mindset, we'll be able to kind of move forward in that idea. Through outreaches that we do, things like the Henry Schein program that we have at the College of Dentistry, we are trying to find ways to provide free of cost dental care to people that need it.
Yeah, we do see that unfortunately on the nutrition side of things as well, with folks that are dealing with untreated diabetes ending up using the emergency room as their primary source of healthcare. And so to have a proactive approach to both oral health and nutrition care is something that we all need to work together to move towards.
Right.
So I just wanted to ask you for some closing remarks on what your opinion is of oral health as it is today, the landscape of oral health as it is today.
Right.
And just any final remarks that you might have.
Sure. I just want to thank you again for having me here today because I'm just very passionate about oral health care and spit, of course, like we talked about. I think it's something that at times we overlook. And we take a course at the College of Dentistry called Diagnosis of Oral Disease, and there is actually a really fancy, kind of scary disease called necrotizing sialometaplastia. And we're sitting in class, and this is going to sound a little graphic, but the way that this disease actually works, it's not cancerous, but over time it will actually erode the roof of your mouth, and the roof of your mouth will actually fall out, right? In a way that you can connect your nose to your mouth. And it's actually kind of horrific, right? If you saw a picture of that, you'd be like, whoa. We see pictures like that all the time, just kind of our training. And somebody actually raised their hand and they asked our professor, I don't understand, why would somebody let their mouth get to that, right? And she actually asked, well, when do you go to the dentist because you feel pain, or do you go to the dentist because you care about your oral health? And I think the answer to that question is a very important part in how oral health care in America is going to be answered. Because some people will say that, oh yes, the roof of my mouth is hurting, but it's not that bad yet. Like, I'm not ready to dish out $100 to go out and take care of it. Because for them, they would rather have the roof of their mouth fall off first before they can actually see a dentist, or they see an oral medicine specialist. And that's kind of shocking to me, right? Because we need to understand that's not okay. If you're in pain, what ways us as dental professionals can provide access to you so that you can get that pain treated, right? And what education can we provide to our to the public in a way that you're taking care of this, so that even when access becomes available, you don't necessarily need it, and it's for higher procedures. So I think a lot of it has to do with being well connected to a dental professional that you trust and cares about you. And I'm wholeheartedly encouraging a lot of my colleagues to pursue more public health aspects, because we so desperately need this idea of better insurance and better health care and better access, but also the idea that we can encourage people to really better their own health care, right? Or can you set aside a certain amount of income that you have in a month? Say you're not insured, but you can set aside, this is my dental fund. This is my $20 a month I'm setting aside for my own healthcare, right? Or I am willing to spend $100 on a good toothbrush because I want to take care of my oral health. I know this toothbrush may cost $5, but if I invest $100 now, maybe I won't have to spend thousands of dollars on crowns and fillings and implants, right? So I think that one thing that I posted for Valentine's Day is roses are red, violets are blue, but a toothbrush costs less than a filling or two. And I think that has a lot to do with knowing your priority now and knowing that you can stop infections in your mouth now. And I think if I had to leave you with some practical tips now for whoever's watching right now, I think it's really important that you drink water. Because the way that our saliva flow is a great way in buffering acid in our mouth. So try to be as hydrated as possible. I think we underestimate that usually, especially as students, because we're like, water will come and go, right? But we kind of underestimate it. Another thing is that if you have the ability to chew sugar-free gum, and I'm gonna emphasize sugar-free gum, and they will actually have marked on the package that this is an American Dental Association approved. So say you don't have the time to brush your teeth after a meal, go ahead and chew that gum so that you can have some sort of mechanical debridement until you can actually go ahead and brush your teeth. I think the third thing is to invest yourself in a toothbrush that you really like and you really enjoy. I myself use an electric toothbrush, even though the studies show that a mechanical, just a regular manual toothbrush and an electric toothbrush have the same efficacy. In fact, a lot of people, that's contingent upon your own technique. So whenever I use a manual toothbrush, I know I'm brushing too hard, because I had this idea of like, I'm gonna get all the plaque out, so I'm just like going real hard. And I know that's really negative, and I do see gum recession on patients that do that because they're like, I'm just trying to brush as hard as possible, and that's just not always healthy. So if you feel more comfortable using an electric toothbrush, to take that investment towards it, because it's going to be worth it. And I think that's also very important. And to build a routine, right? So for me, flossing is very hard. I'll just be very honest. And I tell my patients that all the time. But I bet you flossing for me is harder than it is for you. So I think you have to build a routine, and that's the fourth thing that's very important. I'd say that if you have a nighttime routine that involves I'm gonna watch an episode of The Office or Netflix, but I'm also gonna floss my teeth at the same time, there is a positive reinforcement to it, so that now that every time you watch TV, right, you're like, it's flossing time, right? Because and through that, I know that there is a reward for me to do flossing, because I know it's a part of something that I do. So just kind of recap is to stay hydrated, chew sugar-free gum if you have the opportunity to. If you're not able to brush your teeth, the third thing is to invest in your oral health care with a good toothbrush, with floss, even with a water pick, a water flosser. And the fourth thing is to build a really good routine, right? Obviously, we usually wake up in the morning to brush our teeth, but also build a routine at night to floss your teeth and brush your teeth, so you can prevent any diseases that may be lingering in your mouth.
Well, thank you for those. I think those are very helpful. And I'd just like to add, from a nutrition standpoint, to reduce your intake of sugary beverages and foods, and eat foods such as calcium fortified foods that are important for tooth health as well. If there's anything else you'd like to add to that?
Yeah, milk is great. You wanna keep your calcium content high. You want to maintain a low acidity diet, usually foods like orange juice and oranges and orange juice, and those things that have high sugar content but has high acidity content may be harder for people that have that are more sensitive. And I would say, if you have a problem, feel free to reach out to dental healthcare professionals, because we're here to help you. And you can come to if you are in the New York area and you need a dentist, feel free to come out to the College of Dentistry, and we'll be sure to take care of you.
Great. Well, thank you so much for joining us today. This was very informative, and it sounds like your mission at the School of Dentistry is also to have a preventative standpoint on oral and dental health. And as public health students and a body of public health researchers, that's what we like to hear. So we wish you the best of luck in your mission to improve oral health, and we look forward to hearing from you again soon.
Thank you. I wish the best of luck to Nutrition Without Borders, and to put more efforts into causes like this. Thank you for having me.
Yes, thanks so much.